Thank you so much for being here. And we are going to try to end at 3:30. So we've got, we'll have a rousing meeting again that will be very packed. And you got your agendas in front of you. And I hope you got the email that Amy sent out that had the graphic and some other things just to kind of trigger your thinking. But let's go ahead and start with the roll call, please, Amy.
Okay. Mary Campbell.
Here.
Judy Buchanan.
Here.
Trisha Malott.
Here.
Corey Tello.
Here.
Gabby Bonte. Was that you, Gabby? Is Gabby the one that's on the phone?
That could be me. That could be Joan, because I have to call in.
Gotcha.
Okay, so we don't have Gabby here yet, but I think she was planning on joining us. Taylor Davis is here. She's part of health, behavioral health. Maureen Solers is here. She's part of AOK. And Joan Hartman.
Okay, thank you so much. And do we have any public participation?
No.
Okay, thank you. All right, we will go ahead and start with, we're on updated information about marketing campaign from community stakeholders. And some of you may have done as I've done and started kind of reaching out and talking to people. And so if you have any updates, that would be fabulous, but I will share with you. And I'm so sorry to talk at you for a little bit, but I just want to share some very, very robust conversations I had with a few different groups. And I'm hoping that this will help trigger us in our next steps. But I'm going to start by sharing with you, I had a conversation with Kent King Nobles, who's the pastor of First Methodist Church in Normal. And he's a member of the McLean County Interfaith Alliance. And he was helpful in telling me about who heads up that McLean County Interfaith Alliance. And it is Christine McNeil, who is a senior staff chaplain at Carl. Some of you may probably know her, Carl Broman. And Molly Ward, who also, I believe, works there. And then Rabbi Dupage, who is at the Moses Montefiore Temple. And so I will be reaching out to them to see if they can help us get, messaging out and what would be most helpful to get this spread through all of the types of religious organizations we have in the community, because that is a very diverse group. One of the things that Kent King Nobles shared with me is he felt, I asked him about, Joan Hartman through Chestnut. They have someone that sends out the constant contact updates for social service agencies and other things. And again, that's a great way to spread the word through getting that out to everyone who can then put it on their own websites and social media posts. And Reverend King Nobles did say he felt like he's quite certain that if we ask to have all the churches on that constant contact list so that they would have it to send out, to put in their electronic bulletins to their parishioners and all the messaging they're doing right now, including services online and all of that. So that would be a great way to reach a lot of people. So, and then I also learned that Dr. Bridget Black, maybe some of you know Dr. Black, who she is the minister at Wayman African Episcopal Church, Methodist Church, and she heads up a Black Ministerial Alliance. So I will be reaching out to her too to do the same, make sure we got all of those churches on board as well. So that'll cover a lot of ground for our messaging. So I was excited about that. Then I also spoke with the Dupage County Mental Health Center, which is in Wheaton, and they have a very robust behavioral health system that actually operates right under their, it's part of their health department. And they have recently started a HEART team, which stands for Health, Equity, and Access Team, but they're doing exactly what we're doing, which is, just really trying to get messaging out about all sorts of things. Because clearly one of the things that, as being part of the health department, in addition to getting messaging out about behavioral health services and supports, we also want to get messaging out about just health in general. And because all health is behavioral health and vice versa. And one of the things that you probably heard on the media that we are knowing more about is that we assume that some people of color may have some vaccination hesitancy. They may be very reluctant to be vaccinated for many reasons, one of which was, experimentation, medical experimentation that was done decades ago without their informed consent and all of that. So some of that distrust persists. And so we may also need help in making sure that we can overcome some of that distrust of vaccination. So anyway, that's one of the things that team is working on. So again, this is Dupage Mental Health Center in Wheaton. And I should say, it is their health, equity, and access team. And I thought it would, what they have done is they put together a team that meets regularly through Zoom. And they've included hospitals, community advocates through social service agencies and others. But this was an interesting one that we, I think, haven't hit on yet, which is township supervisors. So they've invited the township supervisors to sit in, and that would cover a lot of ground because I believe in McLean County, we have like 16 townships. They've invited union members, Chamber of Commerce, state representatives, and what they've been doing to advertise, not always just 211, but just messaging in general about take advantage of services that are available. They've advertised at mobile testing sites, at drive-through testing sites. We've done this, food distribution events. They are talking about advertising at vaccine clinics. Makes a lot of sense to me. That's going to see a lot of people. Water bills and things like that. And I think, Tricia, I remember seeing on the tax bill that you advertised fuse and triage, right? Yeah. So
Can I add something real quick to that?
Please.
So the Emergency Preparedness Program has an AmeriCorps member, and she is, as far as like with equity and inclusiveness with getting the vaccines, she's tasked with that assignment. And so I think it would make sense to connect her with this team because
Absolutely.
pretty sure that they don't have, I'm pretty sure they don't have, I haven't heard of her reaching out to, or that program reaching out to the health department. So if we can get that information to connect them, we wouldn't be duplicating work because that's her main focus.
That's fabulous. Very good. Okay. And then they also involve service clubs like Elks, Rotary, Lions, etc. They've advertised at gas stations, veterans clinics, and then just talked about, doing educational programs on diabetes, telehealth, etc. So I thought that was all really good things for us to think about as we think about how we want to get our word out. Other people have come up with ideas about that we should reach out to the homeless liaisons at schools. I think we mentioned that at our last meeting. We also talked about English as a second language school liaisons because, all the schools have bilingual programs and they all have like case managers for families. And so that would be great. And then obviously the Housing Coalition, which I think obviously PATH is a big part of that. So I'm sure that that's being taken care of. So, anyway, any thoughts on that before I go on and share other things? Okay, and then another group that I had this conversation yesterday. It was really powerful. It was with the health committee of the NAACP, and some of you probably know Arlene Hosea, Jana Edge, and Karen Stipp. Karen is a professor of ISU at the ISU School of Social Work. And I believe Jana is a retired nurse. And Arlene Hosea worked at State Farm and now is very active in many things. But anyway, so this again is the health committee of the NAACP. And they were very happy to be involved in this conversation. And we talked a lot about and I have to say, because of who it was, we ended up talking pretty predominantly about the Black community, not the Black and Latinx community. So most of what I'm going to talk about is more the Black community, but they felt strongly that whatever we do with that group is going to be wonderful, because it's going to lay a foundation for hopefully long-term relationships that we can have on many shared initiatives in every type of health, including behavioral health. And talked about, again, how important it is for relationship building, trust building, and that for the Black community, personal touch and personal communication and personal connectedness means everything. And I don't think that's new information to anyone. They thought that education and empowerment, that we're going to have to do some things to have some shared education and empowerment activities. And Karen Stipp mentioned that there is something on the SAMHSA website about shared decision-making in just seeking health services of all types. So we probably want to take a look at that. Some of you may already be very familiar with that. And just the idea of kind of increasing health literacy in general. They also mentioned that a wonderful, we've been talking about who are those influencers in these communities and neighborhoods, who are those liaisons. And they mentioned, and again, I would ask if any of you know Tony Evans. And I guess Tony Evans is this incredible Black man he's on the Human Relations Commission. He works at State Farm. He's an organizer for the whole community of Black-owned businesses, and I guess recently sponsored a Black Business Expo. He is apparently extremely recognized and respected, and they thought if we could have him be our introducer to certain groups, that would mean everything. So Arlene was going to reach out to ask about his willingness to, join with however we decide to do that, to create that. But when I told him about the idea of barbers and beauty salons, and again, I thank Tricia for that, they thought that was a fabulous idea and thought we should pursue that pretty straight, as fast as we can, and thought that actually Tony could even be the ones that might help identify some barbers. And Karen Stipp apparently knows several Black female salon owners, and she could be kind of the one that puts those together, and thought that maybe we could work with them on, again, how they could help us with messaging. They also thought yard signs was a great idea. And again, we thank Tricia for that. She's our little brain engine here. But they also said that for this population, that we got to have a relationship with them before we just walk up and say, can we stick a yard sign in front of your, business or your barbershop or whatever. So we need that connection, and they're going to help us do that. They also mentioned radio station. It's an FM radio station, WX. And it is a radio station owned and operated by the Black Business Alliance. And Arlene said she's done several public service announcements on that, and thought that would be a place that we should try to put public service announcements. She also said Black Greek sororities and fraternities, which I think this group had talked about too. I did ask her what they thought the biggest barriers were of why African Americans might be resisting seeking support, acknowledging the need for support, seeking vaccinations, all of that stuff. And I mean, some of it's very obvious, as we all would know, but they just articulated, and I thought this was helpful. And again, I think it's some of what we already know, but I think it's just really helpful to kind of lay it all out again. So fear of social embarrassment among their peers, fear of being perceived as weak, vulnerable, or crazy, fear of not being manly, not being in control, fear of medication and health care in general, again, because some of the things that happened historically that where they were not informed or used against their wishes. And also, which we all know that many times the people that are delivering services do not look like them. And so they have real concerns that they do not fully understand them and their needs and their background. And they're also not sure that they're going to be there for them long-term. So I think those are all things that we've got to, figure out how we're going to address those. So let's see if there was anything else I missed. I think that's kind of my reports, other than Judy and I have had some more calls with Karen Zangerly of PATH and David Taylor of United Way. And I also had a conversation with Kevin Richardson at PATH, and we can give you an update on that. But before I go on, just other comments about just reaching out to, ways to, again, connect and reach out. Anybody have any thoughts?
I have a question.
Sure.
This organization, Dupage Mental Health, how long have they been up and going, and do they have any, have they collected any data as to the success rate that they've achieved? I never think you need to reinvent a new wheel, that, go with something that's solid as long as it is solid. So, it looks like they've covered so many bases. It's very impressive.
Yeah, I think they're just getting started, though. I think they have had, I believe, the third meeting. They've only had 3 meetings so far. And so they've just put this group together. And so yeah, I don't think they've got much data, but they actually, their meetings are online on YouTube. And I actually watched a whole meeting, their most recent one, which was just Monday, I think, maybe, or last Friday, I can't remember, but last Friday, I believe it was, and I watched it, and it was good. They're finding their way too. But what's really fun is just watching in real time how people who had never met each other were sitting there on the Zoom call saying, "Oh my gosh, I'm so glad that I know about you now, because now outside of this meeting, I'm going to call you and we're going to do X and Y." So I think putting all that together, and all of the organizations I mentioned, they were not necessarily on the call, but they have all been, they're thinking about making sure everybody can come to the table in some way. And the ones that definitely are at the table are hospital reps and township supervisors, state rep. Has come, but I don't think he was there on the Friday meeting. Just obviously social service people and that, but they've got, it was a very diverse group and lots of advocacy groups. So yeah, I think we should definitely, and they've got some policy things I think that they've written to go along with it. So I think we should get our hands on all of that. Yeah. So yeah, thank you.
You went all the way down the list of Black-owned radio station and then fear factors. And, some of those, boy, could be the focus of an entire committee. The whole issue of lack of trust in healthcare. They have every reason to have a lack of trust in healthcare. And that's a really big barrier to, and I don't know how much we can do with the, even like the local emergency room staff and all those, individuals, and we know this is all the studies say that when Blacks come in for this, they get treated for that. If they come in and they're in pain, they don't give them the medication because they're afraid. It just goes on and on. So that's like a whole big thing, is how do we roll out, in the case of this vaccine, how do we roll that out where people feel safe going in there?
Absolutely.
Same thing is true with mental health. They have a lot of reasons. That's a big one right there, just that one alone.
Yeah. Now, Amy, tell us the person that you mentioned. You said that's part of the EOC. No, it's part of what? Tell me more about that.
The health department's emergency preparedness program has an AmeriCorps member And so for the vaccine, and there's just so much controversy and distress anyways from COVID, and then adding everyone needing to get the vaccine definitely adds to that. But I can't remember the last name, but anyways, they're a AmeriCorps member. Like that's like her focus is looking at equity, inclusiveness. How do we like promote, advertise, doing all of that work. So as far as like the behavioral health program at the health department, it's just, that's her focus, is doing that work. And so it's just having collaboration as far as just like reviewing some of the information, making sure it's trauma informed, that it's appropriate. So there's that collaboration piece, but that's the AmeriCorps is really focusing on that right now. So, and I think that one of the pieces that she could definitely benefit from. So she did reach out to she has a PowerPoint she's completed for this. And she, with the AFNAP for individuals with functional needs or intellectual or developmental disabilities, she presented to those agencies during a meeting. But I think like her getting connected to these other folks that are working on that would make the most sense. And kind of what Mary was saying, like not redoing what is being done. And yeah, her
Absolutely.
connected would.
Now, is she, do you supervise her or the emergency preparedness?
Emergency preparedness coordinator. She works for the emergency preparedness coordinator. And I don't know if she works for CD also or not, but
she is, that is under the health department? Yes.
Yeah,
Okay.
emergency preparedness program.
Okay. I just want to make sure
it's part of the health department.
I'm confusing it with that whole emergency management county-wide team, but this is, you're talking about the department and the health
I'm
department.
not talking about EMA. That's through the county. So
Okay.
They collaborate, but no, this is through emergency preparedness.
Okay, go ahead, Judy.
David then? Does she work for David, Amy?
Yes.
Okay.
Yes, we will definitely.
Sam.
We'll definitely help
Taylor,
you
what's her last name?
Samantha Maynard.
Thank you, Taylor.
Yeah, we'll definitely make that connection to the health committee of the NAACP, because that would be very important, I think. Yeah. Okay. But I agree with you, Mary, that is a huge piece of it. And I do think our, the health committee of the NAACP can really help us with that by identifying those influencers we were talking about before that can help us, make those connections. And so I think they seem very committed to doing that, because they are concerned about the vaccination hesitancy that they assume may be a problem, as well as, again, just the whole need for behavioral health services that they're not seeking. So, so that relationship will continue. And I don't know, we may even decide one of them should be invited to come to this meeting, for be a community member on this committee, just like Joan is. So, okay. And then, so the other thing, go ahead.
Oh, and just real quick too, as far as with like the stigma and the vaccines associated with that, the CDC and Illinois Department of Public Health have also come out with messaging that they want to make sure that the vaccine, that it's inclusive and that they're watching it too. So there's people at different levels that are watching that.
Good. Okay. So then I wanted to kind of talk a little bit about 211 capacity, because I think we've all continued to be concerned about if we really do start massively campaigning and getting all this everywhere to everyone. Does 211 really have the capacity, and does our social service system have the capacity? And I don't know that we have a 100% clear answer on that, but recent conversations with Kevin Richardson at PATH, their numbers are certainly going up, like from first quarter to third quarter. I believe this last quarter, which of course would have ended in September, right? That had jumped to, I think they had about 500 more calls in that quarter than they had in the first quarter. So it's going up like about, it went up about 200 second quarter and then another 3 or more hundred in third quarter. And so I'm assuming it's continuing to go up. I just emailed Kevin to find out what they were right now, but of course he probably hasn't put together, he can't do fourth quarter estimates yet, but we know it's increasing. And the text line is up now. I think it kicked off officially about a week ago, and they're only getting about, as of November 31st, which was the last time I spoke with him, they were just getting about 1 text a day. So it isn't widely known yet, but I would love to know what's happened, just in the last 9 days, because I just still believe that if the text line if people start knowing about it, I just can't believe that won't be a choice for people even over the phone. So we'll have to really monitor that. Kevin was feeling like they could keep up, as was Karen. When Judy and I talked with Karen and David Taylor, they continue to say that's what we're here for. We want to tell you to go ahead, but I know they have to be really careful about, we don't want calls to be dropped. We don't want lag time and all of that. So I think our best bet is to, roll this out, and for us to be very intentional about sequence and timing, and be mindful of when we're hitting certain groups, what that potential numbers could mean, and then just staying in really close contact with PATH to see how it's going. They are planning on another training. They just completed a training. Let's see, let me find that information.
Was it February? Wasn't it February?
Yeah, they're starting another one in February, and people will not be finalized until April, because it's about, by the time they go through all of the training and have the supervised call time and all of that, it's about a 2-month cycle. And then they're going to do another one in June, and that group would finish up in August. They do somewhere around 25 to 30 people each time they train, but always they have a few drop out during the course of training. And so they usually end up with about 20 to 25 that at the end of a training are really trained and ready to go. They are expected to do 3 hours of on-call time, I believe, a week. And then they are expected to do 1 overnight period a month. And so they commit to that, and they commit to 120 hours of just call time in general. So in other words, before they even get trained, they have to say, yes, I agree that I will stay with this for 120 hours of time to PATH, which is why some people drop out along the way. They said that they've got a pretty robust system for getting volunteers. They've got a whole system of notifying every time they do a training, and it's, the big businesses, it's all the universities and community colleges, it's small businesses, it's and advocacy groups and things like that. They still rely pretty heavily on students, and they, obviously go in and actually talk directly to student classes. Mary, you probably remember that. I don't know if that, where they actually talk to social work classes and psychology classes and nursing classes, et cetera. So they did not feel that they need a great deal of help with seeking volunteer recruits. So, but, I asked them about church members, because I thought if we're going to blanket churches anyway, should we just pair that up? And he said that would probably be a great idea. I think the same thing is true with, if we do the Black community, we should probably try to get volunteers from there as well. So any thoughts?
Yeah, sorry. My computer froze. I kind of missed a couple minutes, but I had a conversation with Path 2 recently as part of my job role, and the latest was actually today with Kevin, and Karen has some input to give Kevin to pass on. But what they are saying to me is that can everyone hear me, or did everyone like freeze?
Yes, no, we can still hear you.
Okay, great. So what they said to me today, and they had said this also prior to this, but was that Kevin said that they're at like 15% more capacity than what they are usually, and that they do have the 3 billboards. I don't remember where they're located. We talked about that before in this meeting. And they have one that they're planning on paying for through January. But if those continue, they'd have to be funded. But according to what Karen and Kevin are saying is that in order to be advertised more through like the continuation of the billboards or through other signs or through other methods, that they are saying they require a part-time person through COVID to work Monday through Friday, 9 to 2. They don't have the funding for that. So I'm not sure like if they're, so there seems to be a barrier with us promoting 211 and then 211 saying that they need this. And they talked about the difference between volunteers are awesome. They also talked about the difference between volunteers and paid staff. So I guess yeah, it's a little bit conflicting with what I'm hearing is that they're saying like right now they can take on extra, but that is not what they are saying to me. That they're saying to me that they need the part-time position funded through COVID to help with the already increase and then the increase that our work could do in getting more people.
Yeah, no, when Judy and I talked with Karen and David, Karen was like, go ahead, but she was definitely telling us that their stats were being impacted somewhat, like they were having more dropped calls because people were having to wait a little bit longer. And they were, the number of seconds it takes to answer was increasing a little bit. So they were, of course, concerned about that. Karen said,
because they're telling me not to go ahead.
And then
so I'm hearing the opposite message.
No, let me finish. But when I spoke with Kevin had said the same thing to me. It was that the 9 to 2 time has become a big, and that's again 9 in the morning to 2 in the afternoon has become really peak time for them. And Kevin shared that needing supervisory time during that time would be very important. And he was saying about a 25-hour-a-week person to supervise during the peak time would be very, very important if we were going to grow. So go ahead, Judy.
Yeah, and this is interesting because while both Karen and Kevin expressed some caution with us, they in no way discouraged us from doing this, but maintaining good, frequent communication with them to monitor it. So I'm a little confused now, but, and I think we're going to have to clarify that because we don't want to set something up that we know is going to really create more of a problem than it's going to solve. But secondly, Amy, I wonder, are you familiar or can you update us on the status of the call center that the health department is in the process of setting up for COVID calls? And I'm wondering to what extent that might relieve some of the calls that are going to PATH, or do you know?
Unfortunately, I don't have a lot of information on that. I know we have the Board of Health meeting tomorrow, and so hopefully Jessica would have a lot more information on that. But my assumption, my guess is that, of course, it's being staffed in relation to COVID, but part of that too is still that emotional support, the stressors people are experiencing from that. But I don't know how like that's going to be advertised or how many people are going to know of that versus PATH, or if that's going to assist PATH. I'm not sure.
Mm-hmm. Thank you.
But I do agree with you, Judy, too, that I think like clarity on, because I know we talked about those 3 billboards where it sounded like PATH wouldn't be able to carry those on after a certain point. And so I know this group, we talked about those 3 billboards and being able to fund those, to be able to carry them on. And it definitely sounds like we just need some clarification on if that is something that PATH wants done to promote 211, or if that is something that maybe at this point they're watching the numbers and they're concerned. But
And I'll get into some of those tools when we get to that part of the agenda about billboards.
And actually, Judy, I think we're probably there. I think that clearly what we may need to do, and I would love to have either Karen or Kevin participate in these meetings. I don't know that they could take the time, but even if one of them perhaps could be on just long enough to, like every time we have a meeting, if they could be on just for a few minutes with us to make sure that we're all on the same page, that would be great. I think that I'm going to ask if we can have that happen, that even if they can't stay for the whole meeting, if they could be part of it. And we would always, before we do anything, I mean, we will be hand in glove with them. We are not going to get out. We're not going to do anything without them being completely on board with it. But I agree with Judy, conversations with them have been to us, yes, cautiously optimistic. We want to keep going because that's what we're here for. And the next few months is going to be the roughest we've probably ever seen. And so of course we want to be there, but obviously we also don't want to frustrate people if they're having to wait in a queue to be called. Now, when they said they wanted the money, COVID, you're saying they're wanting COVID funding? I'm not sure. You mean they were thinking money that would come through a different avenue?
Wasn't it a staff for the duration of the COVID? Was that, Amy, what you were saying?
that was the way that I took it, was that they
Just wanted to make sure.
a part-time staff person 9 to 2, and then it was definitely during the COVID response. And then even with that, with like during the COVID response, like we still don't know how long the COVID response.
Yeah, I was going to say, that may be another, we may be easily talking fall, easily. Yeah. Okay. But I just wanted to make sure that I was understanding what you meant by that terminology. Okay. Thank
Yeah,
you.
because I think that they were, and I think that part of that is also like wondering if the health department, or the Board of Health rather, if the Board of Health would be able to, if doing this advertisement, of being able to look at funding that position.
And again, they were talking 25 hours, not a full-time position. When I
Yeah,
talked-
9 to 2, I think it was Monday through Friday.
right. And again, 9 to 2, because that's been really their peak. Yeah. Okay. All right. Good to know. All right. Any comments about that? Anybody, before we have Judy give us an update on kind of real getting into the deeply into some of the tools we might be looking at?
Okay. Actually, I had put together a list of the kind of considerations before we even get into the tools. And one was to monitor the capacity. So I think we really do have to have those conversations, because I think we have to be mindful that the Board of Health has a COVID campaign, a media campaign that's in process, and they're really going to be stepping it up. In fact, the Board of Health will look at the complete campaign tomorrow. So that's out there. There's going to be some vaccination messaging. There's going to be some COVID messaging, and then behavioral health. So I think us proceeding cautiously while not abandoning it is important. We need to be able to get the message that can be shared across the board with a number of organizations. And I really, as I said to Corey, the more people we talked with, the more the notion of trust and getting into where people are known to their constituents, their parishioners, their customers, whatever, is going to be very important. Probably the same message, because I don't think we can start printing up multiple messages, but the way that it's presented is going to be important. We are prioritizing some of the tools that I'm going to suggest we look at first. And that's really been based upon the kind of conversations we've had. In fact, in some very specific conversations and just in general, the use of the billboards is kind of questionable. It's a big hit of money. And many of us have been reminded to drive down Veterans Parkway and tell me how many times you see the sign for Path or for United Way. You're traveling 45 miles an hour. Hopefully you've got your eyes on the road, if not on something else. So as we looked at trying to get the biggest bang for our buck, that now is pretty far down on the priority list. We're looking at using the Constant Contact platform that Joan and Chestnut have got and really trying to push out some more messages there. We're looking at being able to, we could actually start in January, do a 6-month campaign on the rear of some Connect Transit buses. That's for about $500 for that 6 months. We can look at social media. And again, that would be, I'm scheduled to meet with the people at the health department who are doing it for the 2 campaigns that they're going to have going, so that we don't end up, creating more confusion when in fact part of the design of this is to reduce that. Yard signs, if we went with 2-sided, fairly substantial corrugated plastic yard sign. Initially, if we went with 250, that would cost about $500, and that's 2 sides and probably a colored background. I want to stay away from the white billboard in anticipation that we're going to have snow sometime in the next few months. Instead of flyers, it's been suggested, and this really seems to make more sense. A flyer is a fairly flimsy piece of paper that ends up maybe being discarded or falling out of the bag or the box more often than not. To look at cards, kind of something that's substantial when you get your hand on it. So it's more of a piece of card stock or something a bit more substantial, and perhaps use something that equates to there could be four printed on an 8.5 by 11 size sheet of paper. So we're looking at about 4.5 by 5.5 card that would have our message that could be given out in a variety of ways, depending upon how some of our partners think it's best distributed. We talked about business cards. It was suggested that again is another way to get something in someone's hand that's a bit more substantial than a paper flyer. In fact, you can get business cards with magnets on the back, and they are not terribly expensive. You get 200 or 300 for maybe $50 to $60. And again, that's going to get it perhaps put up in someone's home. Talked a little bit about a banner outside. I have a banner that was used for another organization. I was hopeful that we could just use it again, and I'm told we can't. But at some point in time, we might want to look at a banner over maybe down Front Street leading into downtown Bloomington or something in the town of Normal on one of the more heavily trafficked streets. So that's kind of our tool list. And I think that's messaging to me is going to be very important. We really do have to create a message that, while I'm saying that the drive by the billboards is probably not resonating with a lot of us, the message needs a lot of space and it needs to be very pointed. So when you look at it, it sends a thought to you right away. And I think that's something that we need to spend a lot of our time on this afternoon. So that's what I have, unless there are some questions.
Judy, can I ask a follow-up question, please? So when you are talking about the messaging, I just want to clarify that you're talking about then it would still be referred to PATH, correct? So there'd be messaging and then it would still be called PATH, or were you talking about different messaging?
Well, and that's a question Jessica and I have met with, not Jessica, Corey and I have met with Jessica a couple of times, and the message that right now is out there has the United Way logo and the PATH logo. My question for us, and that's on my list for this afternoon, is are we going to have to find that we have to add a lot of logos on the bottom of this, on the cards, the yard signs, whatever we put out there? or because United Way and PATH are already established at this central point, are they the only ones on there? And that is an issue, because some organizations may not want to put that out on their website, for example, or on their Facebook, if it isn't acknowledging their organization. So I do believe we have to think about that, because I don't want to, have, again, the clearer the message is, and the more succinctly, without having a bunch of logos and a number of organizations listed, I think could be problematic.
So thank you very much, Judy. That takes us right to the thing about messaging and putting it in front of focus groups like we talked about. So you should have gotten an email from Amy that you should have gotten, again, the graphic that is currently being used. And then I included just two messy old things that I just took what you all said last time and what the behavioral health priority action team members said when they had a meeting a couple weeks ago. And I just kind of grabbed some adjectives that people suggested, and just, again, some messaging. So the two things you have that have blue and red ink on them, that isn't meant to be a graphic. It's meant to trigger our thinking about what could be on a graphic. So what, again, I'm going to task us with doing is, like, what are the most salient words that kind of describe what people are feeling that would be the reason they would be reaching out. And then the other thing we have to really figure out is, what message do we want to make sure that the signage delivers that says, if I reach out, what's going to happen to me? Because I feel like sometimes if you just say, get connected, call, you still don't know. Does that mean you're going to be talking to a person? Does that mean you're going to be talking to a therapist? Does that mean you're going to be talking to an answering machine? So it's like, so that's why I was putting out, that you would actually, talk to a real person. And again, do we want to have a message more like, instead of, we know you're struggling, so make a call? Or do we want to say, we know you can make it, and that's why you need to call? So, I guess it's kind of weighing what's the optimistic message, which is more of a versus, get unstuck, get out from your depression, versus we can help you thrive. We can help you, make it. So that's what I want us all to think about. So did anybody have any thoughts as you looked at this about how to succinctly? So again, I think we need ultimately a graphic that looks like the original one, because it can have a lot of words on it. But I think we've all said that we don't believe the one we currently have now, while there's certainly nothing wrong with it, that it may not grab those people that are already resistant.
Corey, if I might just tag on to that, I had a conversation, a couple of them actually, with a couple of people very active in our community, and one of them has been involved with Not in Our Town probably since the beginning. And I was reminded by the comments to make sure that, what is 211? This person was saying, not everybody even knows what that is. And what am I going to expect? And what kind of help am I going to get? If we say you can get help, what's 211 and what kind of help? And again, the challenge would be to get all that into a very brief statement. But we can't make it very many assumptions other than we think people might be hurting out there.
Yeah. One of the NAACP health team members said, maybe we should just say call and we can talk, keep it really simple. But I don't think that gets you to, that this is where you really would, if you're in, dire need, this is what you can get to. So, and then another suggestion was, I guess, the phrase, it's a lot, is kind of what younger people are kind of summing up the whole pandemic experience. Just, it's a lot. And so, would that be a tagline? It's a lot. Reach out to have someone, talk with you through it or something. So obviously Obviously, I do not have the answers here, people, so I am throwing this out for some clarity. But I like your point, Judy, that I don't even know, maybe it needs to be more like, you know, reach a person, reach a
And go ahead.
reach a helping voice or reach a helping person or something. Yeah.
And I think to Corey's point, hopefully we can come up with those words, those words, proactive words that are going to lead this message. But in terms of how it gets laid out and it looks, there are people that are available right now to help us with that. So we don't have to design it as such or lay out the graphic. But when I go to someone for graphic help, they're going to say, what's your message? What are your key words? And that's what we need to really hammer out, hopefully this afternoon.
I have a comment about your, I don't have the answers to the wording, but I remember a long time ago, United Way funded this little project to get the word out about sexually transmitted diseases, I think it was. And they talked to young people and they said, what kind of a flyer, brochure, blah, 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 banner, whatever would be useful. And what they came up with was a small card that fit in people's wallets. And it was a trifold, and it allowed them to include a lot of information. And it was something that people weren't embarrassed to carry with them. So a card gets thrown out, a flyer gets thrown out, but it is likely that people might stick a little, the thing was probably, I can't show you, but about that big, you know, it was a trifold, and it had writing on all sides of the fold, and it fit right in your, you know, the guy was saying it fits right in my wallet. It's there. Nobody knows it's there. But I think it was about suicide prevention.
Okay.
Well,
If my friend needs help, I've got that, and I know a number to call now. So I don't know. That was just a thought about design or shape or where to put our money. But you know, the language is something we really ought to run that by a lot of young people.
Yeah.
You know. We ought to run it by maybe this ministerial association. We ought to run it by, we want language that's as close to universal as we can. And, you know, I just, as you were talking, Corey, I just kept thinking something that says, let us try to help.
Yeah.
Because we can't promise we can help, but let us try. And was sort of the
I like that.
upbeat thought that came from your conversation.
Yeah. And I know, Maureen, doesn't the AOK network have a trifold like that that's got a lot of resource contact information for different organizations that support youth? You got one like that, don't you?
Yeah, it's five-fold.
Yeah.
There's 5 sections. Yeah.
And I do
So
love
pocket research guide.
Yeah.
there is something that physicians hand out in their offices. It's a threefold. I mean, just twofold, as Mary's suggesting, for people to track their blood pressure. You know, there's a place to record. There's a place as to what the signals are you should be watching for and how you get help. So there, you know, that's about the size of a business card. And again, we've been encouraged to look at something that size.
Mm-hmm.
So thank you, Mary. I think that's a great idea to get, because that gives them, again, first of all, it's got a lot more educational component to it, and it's maybe going to be more valuable, so they may keep it because it actually has, you know, more information than just here's one number. So I do kind of like that. I think the message needs to be something about, you know, we can help, or like, again, let us help. I kind of like that. Let us help. Let us try to help, or
Let us try to help.
Yeah. And I kind of like that. It's a lot, you know, I mean, because I think that pretty much captures, can anybody argue with that? It's a lot. But again, Joan, I would kind of throw it to you because you were involved in helping make that original graphic, which again, it's a great graphic. So I don't know is there danger in doing two? Is there danger in keeping that one and then putting out another one as well with the same, or is that, I don't know. What do we think?
I think doing an additional one would be fine. My thought was, and I put it in the chat box, that, potentially we could do emotionally stressed, let's talk, call 211. Something very simple and easy, but not intimidating. You know what I mean? Because we don't want people to think, well, I can only call if I'm like experiencing X, Y, or Z. Or even keeping the not. We spent a lot of time talking about that title line, not coping well, because we were looking for something that would lead people to feel like they don't have to be completely hit bottom to call, or they don't have to admit the fact that they're just completely in the throes of something. We didn't want people to go, well, it's not that bad, so I don't really need to call. So it's just like, are you not coping well? If not, let's talk. Kind of, just something real simple. I do think that the one that we did ended up with way too many words on it.
Mm-hmm. Not coping well, let us try to help. Call 211. Isn't that where this is all about?
I think coping has, it's a judgmental term. We use it in human services all the time, but, that's a sign of weakness that you're not coping.
What's another word, Mary? What?
Things not going well, or I don't know, but I just, as you said, coping, it's, it is so human services, but, if I'm strong, and that was one of the comments that I remember Corey said, was not wanting to be perceived as weak, is that if I'm not able to cope, I'm not able to take care of my family, I'm not able to, then something's wrong with me. It's
That's what the NAACP people told me. They said coping. There's nothing wrong with the word coping for most of us, but for the Black community, that's going to be you're thinking I'm weak, and that I should be able to do better than this on my own.
Yeah. So the message is right. I think the word might.
Mm-hmm.
I don't know. Joan, did you have trouble with that word? When you were? Did you use that word?
Sorry, I forgot to unmute. It was like the best we could come up with, because we threw out all kinds of different, and it just was hard. We didn't have anyone from the Black community in our group to be able to give us that feedback. We probably would have picked something different had we gotten that feedback.
Mm-hmm.
What about something like tough times, it's a lot, and then let's talk. I don't know. Maybe that doesn't get to, maybe that could perceived more as financial tough times, or, more of a resource deficiency versus needing emotional support. I don't know. I think there's nothing wrong with any of these words. It's just, you're right, for certain populations, they're more value laden than others. Go ahead, Maureen.
Doesn't SAMHSA or the National Council or some of those larger agencies already have materials that we could look at their wording? I mean,
Yeah, good idea. We should do
they
that.
research this.
Mm-hmm. Yeah, I went on.
I haven't looked, but
Right.
Or even the National Council of Behavioral Health probably should have something too. There should be, you're right, there should be some campaigns out there. Or NAMI, does NAMI have a campaign? I mean, I know NAMI has a hotline. I don't know how they advertise their hotline. And Mary, I did reach out to the person whose name, you had that was associated. You got a friend. whose name you gave me that was associated with putting together that big media campaign for NAMI. And I did make a call. I got what I thought was the closest I could get to a phone number for her by going through a series of people. And I left a message, but she hasn't called me back yet. So I'll keep trying to get a hold of her. Because she sounded like a really good resource. But anyway, does NAMI have anything to you?
There's a webinar that I found this morning and I did not get a chance to look at, and it's a youth webinar. And I'll look through that and see if there's any language in there that sounds, it was one that was done by NAMI, and it's online. It's called, I don't know. Oh, I know. I got it in my NAMI newsletter. That's where I first saw it. It's called Youth Speak Webinar Series, led by NAMI, Ending the Silence presenters. So I haven't listened to it yet. I went online, looked at it, it's there, but I had to leave. And it says they partnered with Warner Media to promote a public service announcement encouraging viewers to reach out and get support, and promoting the NAMI helpline. So that may have some, it was listed under the NAMI Ending the Silence awareness program.
We can look all that up and look on SAMHSA and look at National Behavioral the National Council too. Okay. You know, I just was thinking too, along the lines of those cards with resources on them. I believe that when Colleen O'Connor does her Ending the Silence talks around the high schools and junior highs, I think they always give out a card that has resource information on it, so we can see what they've already got to put together too. You know, okay. All right, so it sounds like something along the line. We know we want to now include Let's Talk. I think we've come to that. I think we have consensus on that. And probably stay away from support or coping, and just something maybe more indicative of, yeah, somehow like this is a universal, a universal struggle. If we can figure out how to convey that in a real simple word. But okay, are there anything else that you think that? Go ahead, Trish.
So I liked your idea, Corey, of the tough times, it's a lot. One, I think it captures the potential for different generations or demographics. The other thought I have, perhaps as language to come before Let's Talk, is we can help you make it through. So tying on one of the comments from the last meeting about reinforcing that, one, that certain cultures and populations need to know that they can do it themselves. And it's not necessarily about helping them. And ultimately, it is about the person moving through it and taking those steps. So some language perhaps about like, we can help you make it through, or before getting to Let's Talk. But I agree with changing from coping. So I would have had a comment similar to Mary's. I've even had a number of people say, I know all the right things to do. I'm using every coping skill that I have ever learned and all of the self-care, and I spend days upon days doing it, and I'm still struggling. What am I doing wrong? And so not coping may work well in some contexts, but I don't think it's now. So just a few thoughts that I had as we were talking, so.
So I was writing down some of the points there, Tricia and others, and this is what I came up with. Everyone agrees these are really tough times. It's a lot. Let's talk. Let us try to help you make it through. Some kind of configuration of that theme seems to be what we all feel takes the judgment away. Doesn't sound like therapy or support group, but just says, let us help, let us help you try to make it through this.
Mhm.
So anyway, for what it's worth, that was kind of what I gleaned from our words here.
Corey?
Yeah, Corey, you're muted.
Sorry, I think that's a great place to end this, and we'll go with that, except Judy, you wanted to say something?
No, I just want to tell
Okay.
you you're muted.
Oh, thanks. Sorry about that.
Tell your mouth open.
Yeah, and so we'll get, and Joan, we do have a graphic design person that's in the health department, so we won't need to lean so heavily on your person. So maybe we'll kind of start with a conversation with the health department graphic arts person, and see, just kind of throw out what Mary just kind of outlined, and then see what that person can come up with. And I think we just need to decide, well, I'll just stop there, and then we'll kind of circle back. And so you might be getting some drafty kinds of things that you can give us feedback on. And we still really would like some focus groups to look at. But we've talked with Jessica about having the WIC group look at it. The NAAC people said they'd bring it to some people. I think if we could get Joan, if there would be anybody through ROSC or something that we could get to look at it, maybe, and maybe some seniors.
I think that
that's
could happen.
I think that's the other group we're kind of forgetting about too, is seniors. So maybe if we can, figure out a senior group to look at it. So, okay, moving on, because we were already at almost 3:10. So we now want to talk about the community liaison idea. When I ran that by the NAACP people, they again thought that was a great idea. Again, thinking the barbers and the beauty salon people might work really well for the Black community. I think now the group we still haven't really captured is the Latino population. So I think we've got to talk to, figure out the Western Avenue people or whatever we can have the same kind of conversation we had with the NAACP people to help us get some of that and figure out who those liaisons should be. The NAACP people felt that a stipend would probably be a good idea, because some of these people have been hit really hard, and right now, if to put in extra time would be to have a stipend associated, that would be meaningful. I think, we have to think about that as, again, as what are the deliverables if we do that, and how to make sure we got that all nailed down. But, and we still are needing to talk a little bit more about rural areas, but that's where I was wondering, maybe our township supervisors could be the ones that would help us figure out who in the townships might be potential liaisons or whatever. What are y'all thinking about that?
Yeah, and I think it's probably certainly worth that communication. I believe that the township as organizations is probably a little bit different and has a much bigger role when you come to DuPage County versus McLean County. But I think it's worth exploring. And I happen to know a couple of those individuals, and maybe I could just explore with them the extent to which, they might like to get involved, because they know the police departments and fire departments and who runs the community center, which are the places we'd like to put some information. So we can look at that, but I think ours perform a little bit different function, but let's check on it.
And then again, this whole idea about just integrating all these efforts. And I think Amy started us off in that direction that, we need to be working with emergency preparedness. We need to be working with the health promotion department. We need to be working with what the cities are giving out and all of that. So we do need to keep everybody connected through this process. And I'm excited about trying to make sure we keep those roads open and getting bigger.
Corey, if I might add on that point, I'm wondering if there is a local effort already underway, with municipalities, with agencies, with county government. Is there a group that comes together with all those sectors fairly routinely. I know that like the health department, Jessica's in contact with those people she refers to as our community partners. But that didn't include always the municipalities. And so I'm just kind of curious, and I don't know where to begin, but if there is such a group, that would seem to be an organization or group we'd like to have contact with.
All right.
Does anyone know of anything along that line, or is everyone sort of out there doing their own thing?
I know that there's a city managers meeting. I think it's once a month. That also includes the county administrator, and it includes the outlying communities.
Mhm.
And so those smaller municipalities, whoever whether that person is called a manager or a supervisor, are all part of that. I don't know exactly how they're doing it in COVID. And I don't know the scheduling of it. I don't think it includes township supervisors. I think it's more intended for town, city, village managers. But that might be one group that captures that.
Yeah, okay, and we could get to them too, because I'm thinking, when you say township supervisors, for example, we have within Bloomington Normal 2 offices, which are supervisors' offices that provide ongoing help and assistance to some of the population we want to reach. When I was thinking about the role being different, I was thinking of those people throughout the county that have that elected responsibility, and they're not so much providing the services. But yeah, the city managers, and they may be now looking at reaching out to bring in, say, the health department or others with COVID, because it's here and they're impacted and they're making decisions or not decisions about violations or whatever, compliance all the time. So I'll check the city managers.
I know in the past, like Leroy participated in that meeting. So I know some of the outlying communities did. There's also, we have a few county board members who are also the township supervisor for the rural area they live in. So some of our county board members may be good resources for that too.
That's what I was thinking. Not naming names, but no, that.
Wow, thank you very much. Okay, I'm just going to try to summarize real quickly what we talked about. So we need to circle back, first of all, with Karen and Kevin, and make sure what we're doing with that capacity, and then what this whole idea about this 25-hour week person, how, where that factors into all this. Joan made a very good point in a conversation she and I had, where she's saying, would there be a way that PATH could literally patch people into some of these state hot phone lines? So when a call came into PATH, if somebody just wanted an emotional support call, could PATH patch them into one of the state hotlines or a NAMI hotline, freeing PATH up to take more calls? And so I think we need to have that conversation with Karen and Kevin also, whether that's even a possibility, but I thought that was a great idea to explore. So we'll do that. And then we're also going to get more direct pipelines to the Interfaith Alliance, to the Black Church Alliance, to the Latino population, and to seniors. So we'll have some of the same kind of calls I've been having, and get everybody on board on that. And then obviously, Amy mentioned we're going to connect emergency preparedness, health promotion, everything we're trying to talk about. And then Trish, wherever the BHCC is and all this too, I'm sure you've got a meeting coming up. Is it Friday? Yeah. So I would love, if there's any input they might have about connecting the dots on this too. And then we're going to explore, I love Mary's idea, we're going to explore the business card, expanded accordion business card idea with information on it. I think that's a great idea. So we'll see and decide what all should be on that. We're going to circle back around with the graphic designer to put together some of the ideas we just talked about and see what that might look like, and get that out for some focus groups. And let's see, I think that's probably about it for now. And the sad thing is, well, it's a good thing. Christmas is coming. That's a joyous thing. But I'm thinking that it's gonna, it's probably for us to meet again. It probably won't be until the first of the year. So we'll kind of try to get some of this, all this information gathered before the end of December, and then hopefully we can hit the ground running in January and try to get this all nailed down. And Judy's done her homework on getting us the information about things to start with. So we really got to get that graphic done. So that'll be our first order of business, and we'll try to get that done in the next few days. Let's see, anything else? Oh, the other thing I just wanted to, I'll let you know, the mental health first aid, the Board of Health, if you didn't already know this, the Board of Health did approve money out of their fund balance to pay for half of a trainer of trainers training. And so we're working on getting that all finalized, getting the billing all finalized so that can happen. And that they're looking, February or March, Maureen, for that training. And NAACP said they would commit to trying to get a couple of people of color to get trained. They're going to try to locate some people. So that's really, that was a good thing. So thank again, and we appreciate all of your input on that. And anything else, Judy, that you can think of that we should be making sure we cover, or anybody else? What am I missing, people? Help me out.
No, I mean, I think you've covered what we should be working on to focus getting launched in January, then late in January. And there's a lot more that we could do, but what we talked about and what you just listed is probably doable. There's just a lot more we could do, but I think we want to, kind of pace ourselves.
I have a question. Corey, you mentioned that we yet had not gotten out to anyone in the Hispanic community, Latin community. And so I wonder if maybe we could get a commitment from some of the folks at Western Avenue Community Center that they might be able to send a couple of their folks that they've worked with for years to attend the trainings, as well as what you mentioned about someone from the African American community.
Thank you. I will definitely pursue that right away, because we want people, because it's a big commitment. It's a 5-day commitment. So people really do have to plan ahead for it. So if it's going to happen in February or March, people need to be starting to make plans now, and even though it can be online, but I don't know, Maureen, I think you're planning it to be all remote, right?
That's the National Council will only allow it to be remote right now.
Yeah, which is good. Okay.
I love Western Avenue Community Center, but from what we hear through Family Case Management and WIC, they're not as a go-to as many of the community churches are these days, and I don't know why.
Like St. Mary's, because I think they
yeah.
fund Western Avenue, don't they? Okay.
Yeah, there's St. Mary's, and there's 2 other churches. I'd have to ask Sophie Rebert the name of them, but the churches are a lot quicker go-to than Western Avenue, with the exception of interpretation. And I don't know why. I haven't gotten that part of it yet. But so when we are talking about finding somebody that speaks Spanish to do the mental health first aid, we need to be anybody that's recruited for mental health first aid as an instructor. We really need to talk to them about, do you know what kind of commitment this is?
Right.
And are you really doing it because you want to, or are you doing it because somebody's putting pressure on you?
Right.
So we've learned that over the last 3 train the trainers that we've done, where when we have people, especially from agencies that are voluntold, we don't get a lot out of them. Even the minimum requirement that their agency agreed to, we don't always get.
Yeah.
So
Yeah,
I'm just throwing that out there.
and it's a
Mhm.
big commitment to do the trainings after you're trained. I mean, that's the big thing. You're committing
Yes.
whole days at a time. So you've also got to have a flexible
Yes.
work life and all of that. Or it has to be a
Right.
work. So, okay, very good.
Exactly.
Thank you. Okay, I think just,
One more thought about that, because I've been really involved on the periphery for several years with the Multicultural Leadership Program. And I'm wondering if there might, because those people have dedicated hundreds of hours really of sitting and learning and trying to be a good leader, a servant leader. I'm wondering if that might be a person, an organization where we could connect with that may have some individuals who are bilingual, who have already gone through that program, and who might see this as a place to really commit their energies. So
excellent. I'll
Absolutely
add that
agree.
Yeah, I'll add that to who I need to reach out to get the same kind of conversations I've been having. So that sounds great. Thank you very much, Mary. This is a wonderful, anybody have any context for area aging? Should I just do the area agency on aging? I think that's where I'd start. But if anybody's got any others, let me know. Okay. And just in the next few minutes, we need to approve the minutes of our last meeting. So that would be the minutes of November 12th. Do I have a motion to approve the minutes? Thank you, Tricia. Do I have a second? Judy, thank you. And any discussion? Okay, all those in favor, raise your hand. Oh, you have to do a roll call. Please take a roll call, Amy, sorry. All those in favor?
Corey Tello,
Yes.
Gabby Bonte said yes on chat. Mary Campbell, Maureen Solers. Sorry, Maureen. Trisha Malott
Yes.
and Judy Buchanan.
Yes.
Sorry, I was just looking at the pictures instead
Okay,
of.
motion, so minutes are approved. So real quickly, Trish, is there anything we should know about BHCC that kind of fits into all of this, or anything that you're thinking about that? I don't mean to put you on the spot, but it just, that's such a wonderful umbrella group.
Yeah, well, so the one thing that I will say is that so I've already put out my agenda and packet for Friday, which means that it will have to fall under other, and it will be a little more time-based, if there's time left at the end of the meeting, but I can bring it up there. The other piece is that once the graphic is done and the messaging is done, we've started to put out a quarterly newsletter that BHCC partner agencies or anyone in the community can also put out through their email lists, through social media, things like that. And it's only our second one, so it's not widely distributed yet, but we can also include messaging in there in future quarters. And I can also probably, well, so I won't take credit for this. I can figure out a way through the assistance of people who are more tech savvy in my department to be more tech savvy and include something additional in our forum session. So once the language and the graphic is decided, it could perhaps be an ending slide when we are doing our forum sessions. And that would be another way to reach people. And while a lot of people will be registering for multiple, and so it might be overkill for a few folks, we also know that there will be unique registration for each one. So even if we reach one person, you know, like that's
a great idea
on a lot of things. So I think there are ways that we can help push that messaging out through some of the other things that we already have planned to do as well. So
Sounds good, thank you. And Joan, I think it's Lori Laughlin that Judy and I should be talking about, and because she's the constant contact person, is that right?
Yes.
Yeah,
Okay.
okay, so Judy and I will probably be having a conversation with her too, just to, if we're gonna start having her keep expanding that list that she texts out to make sure that, you know, she's okay with that, and if there's anything else she can help us think about. And we appreciate that. That's a very helpful, that's been a very helpful thing. Okay, I think we might be ready for adjournment. So do I have a motion?
So move.
And second, and Trish to second. So, okay, well, thank you all so much. And it really, as you have more ideas or more things that we need to be doing, please text me, email me, whatever. And we'll just keep going, and your input's wonderful, and you'll be getting some stuff to give us feedback on. So thank you so much. And if we don't see you before the holidays, have a wonderful, wonderful Christmas and New Year.
Thanks.